All right, I think we're ready. Good morning, everybody. I'm used to a bigger crowd than this. Just joking. This is a big crowd. First, I want to thank the mayor's office and our elected officials for being here today. It's such a momentous day here at Texas Children's in our great state. As a reminder, tomorrow marks the one-year anniversary in which vaccines were made available nationwide. It may feel like months, weeks, or days since that's happened, but we've achieved so much as a country, as a nation. And here in Texas, Wednesday marks the first day at Texas Children's that we began providing vaccines safely and equitably to our community. So, Mayor, thank you again for your partnership, your steadfast leadership in ensuring that every child and family member in our community gets vaccinated. You've been tireless in your leadership, and we appreciate you, sir. So we're here today to talk about a great event here at Texas Children's in partnership with the mayor's office this Friday at George R. Brown. We are looking to administer vaccines to a minimum of 5,000 family members. Anybody that's 5 and up, boosters for 16 and up, as boosters were recently approved for 16 and 17-year-olds. And we're so very excited to do so. George R. Brown this Friday from 12 p.m. to 8 p.m. We have appointments available now, but in addition to that, we're going to take walk-ups. So anybody that walks up, we are going to support. Additionally, we're very thankful to our partners at Metro, in which anybody that needs a ride can simply share our flyers that you can find on our website to get to George R. Brown on that day, whether or not you have an appointment or you're walking up. That's Metro, Metro Lift, as well as Metro Rail. So I want to thank our 17,000 plus employees here at Texas Children's. They have done tremendous work over the past 2 years related to our COVID response, and especially for these younger age groups as we've continued to advance throughout this pandemic. I also want to thank our CEO, Mark A. Wallace. While he can't be here today, he extends his gratitude and excitement for the work that we're doing continually here, providing care equitably to our great community. At Texas Children's, we face and have overcome so much during this pandemic, starting in January, actually, of 2020. We opened up our special isolation unit. We had our first patient under investigation for COVID, and since that time, we've continued to lead the way here in our community. As you can see from being here today with our in-chiefs, we remain prepared and eager to support our community. And our community is not just our patients. Our community is the greater Houston area. Whether you're a child, a woman, a man, we support the greater Houston area. We began vaccinating children 5 to 11 on November 3rd. And since then, we've safely, compassionately, and equitably provided vaccines to nearly 5% of the estimated greater Houston area population of 5 to 11-year-olds. I'm going to let that marinate. That's 5%, but we have 95% to go. So we're in this for the long haul. We want to make sure every child, every family has the ability to get vaccinated here at Texas Children's or in our community, through the city of Houston, through the county. We want to make sure access is available to everybody. It's also important to note that an estimated nearly 5 million children ages 5 to 11 nationwide have safely been provided COVID vaccines. It's amazing to think about where we were last year at this time. Going through allocations, getting an allocation from the federal government because we had such limited supply. And today we have vaccines available for everybody that wants them, whether it's your first dose, your second dose, or a booster. We're in a much different place today than we were last year. We're also honored to be chosen as one of the select vaccine trial sites for children 11 and under, which we've been since April of this year, ensuring that vaccines are provided safely and equitably to kids as we go through these younger age groups. I can't stress enough how proud I am to be representing our 17,000 plus employees, Baylor faculty, and staff about the COVID response we've had to date. As our journey with combating COVID-19 began in January of 2020, and since then we continue to hit the ground running and supporting equitable care to our community, there's 3 key pillars we focused on. Starting first with diagnosis and administering over 430,000 COVID tests, treatment and compassionate care for thousands of members of our community who have been impacted by COVID, and prevention of COVID transmission. Prevention is where we're at now. That's the most important way out of this pandemic, to ensure that everybody that can get a vaccine gets vaccinated. Everybody that can get a booster gets a booster. And we'll continue to fight and adapt throughout this process to ensure that everybody in our community has access. The key thing about COVID is it doesn't discriminate. Male, female, young, old, it impacts everybody in certain ways. Some are severe. We want to make sure that we continue to lead the way in providing safe, equitable care to our community. And we're so very thankful, Mayor, for you coming here to help host this George R. Brown event this coming Friday. We're so very proud and honored at this time to provide this critical tool to our community in our ongoing fight against COVID. People are looking for certainty in these uncertain times. Here's what's certain. Vaccines are safe, vaccines are effective, and they're available. Please get that message if you get nothing else. They're safe, effective, and they're available. Take the opportunity when you have it to get vaccinated. I want to thank the mayor, our various federal and state officials who have been exemplary and supportive of Texas children throughout this pandemic. And with that, I'd like to invite Mayor Sylvester Turner up to speak. Thank you, sir.
Thank you so very much. Look, what an opportunity to partner with Texas Children's Hospital, and this is a team effort. So let me do this. Let me invite Michael Heckman to come up. Dr. Purse is already here. Councilmember Ever came. Just stand between. We forgot our white coats this morning, so please overlook Olivera. Come and stand. Director of Education. Tracy is here. You know. We're just so excited about this initiative. I know we have talked about having this press conference downtown, but quite frankly, this is the best place to have this press conference because the focus is getting people the vaccines. There's not a more credible source than these doctors and nurses and others who have been on the front line over the last 20 months. I certainly want to acknowledge Mark Wallace and his great leadership of this hospital, even in his absence. Really appreciate everything that he has done and what this hospital has done. So again, thank you, Jermaine. It's good to be with you, Dr. Julie Boone, Dr. Flor Munoz-Rivas, and the hardworking team here at Texas Children's Hospital. From the city of Houston this morning, you know, I'm joined by a number of individuals. Dr. Purse has helped navigate us through from day one, and I owe a great deal of gratitude to him. Quite frankly, this city does. For his outstanding leadership. He's provided us advice. He's been our point person working with all of the hospitals in the area. So really appreciate him. He was on vacation but has come back to be with us this week. So thank you so very much. Now he can work 24/7. Michael Heckman is here, who is the president and CEO of Houston First. And this event is going to be at George R. Brown. So really appreciate him this morning and his outstanding leadership. Olivera is our director of our Office of Education. So she's worked directly with our schools and our kids in our city, and appreciate her efforts. And formerly she was with UNESCO, and you know how important that organization is, and now with the city of Houston. And of course, Councilmember Abby Kamen, the councilmember of District C, who has been just relentless in getting information out about pregnant women getting vaccines. And I'm going to ask them to just have some few words after I finish. So let me be very brief. Houston is blessed to have a preeminent medical facility, the nation's largest children's hospital, and ranked the #1 children's hospital in Texas, according to the U.S. News and World Report, in the heart of the Texas Medical Center. Texas Children's Hospital provides health and hope for millions of children and their families every year, and we are proud. And it's not just one person, but we are proud to partner with the doctors, nurses, and staff to encourage more people to get vaccinated, especially when it comes to parents and their children. It speaks volumes about Texas Children's stature and leadership in providing vaccines to the community that First Lady Dr. Jill Biden, accompanied by the U.S. Surgeon General Vivek Murthy, Murphy, visited the hospital last month to begin a nationwide effort to encourage pediatric COVID-19 vaccinations. Now look, I'm not as big a deal as the First Lady or President Biden, but I tell you, I sure made me feel big. So I appreciate that. But I am proud as a native Houstonian, someone who now serves as the mayor of the city of Houston. I am proud to stand with Texas Children's Hospital today to announce this citywide vaccination clinic for children and families this Friday, December 17th, from noon to 8 p.m. At the George R. Brown Convention Center. That's from noon, 12 o'clock to 8, which means if you can come during the day, please come. But if you have to work and need to come after work, you can come as well. Between 12 and noon, they will be at the George R. Brown, and try to make it central and convenient for people to get there. In addition to the nurses, doctors, and staff making this happen, our partners include Houston First and the use of the George R. Brown and Metro, which will offer free rides. And Metro will offer free rides for people who need transportation to get vaccinated. The vaccine clinic will be a safe, comfortable place with all the COVID protocols in place. The vaccination area at the George R. Brown will be transformed into kid-friendly spaces, complete with toys and coloring books, and the entire family is invited to attend. So let me underscore this. You know, Christmas is right around the corner, and still there are many families in our community that's going through a great deal. And so in addition to the vaccines, we're trying to make it available. Families, bring your kids, come get the toys and the coloring books. We want you to be there. That's the number one thing. We want you to take advantage of what's being provided and get the vaccines. Vaccines will be available for children starting at age 5 and adults who need their first or second dose or the booster shot. For nearly 2 years, we have been doing our very best collectively to navigate through the COVID-19 pandemic. And we've had to stay socially distanced and wear masks, and we continue to wear masks when we're indoors. As of yesterday, 3,888 people have died in our city because of the virus. That's 3,888. Many of us have lost friends, family, and co-workers. I have lost 14 city employees, including police officers, firefighters, and municipal workers. And most, if not all, were unvaccinated. Still, our hearts hurt for each and every one of them. We owe it to the people who have died and the heroic healthcare workers who have worked valiantly to save lives. And we owe it to ourselves, to our children, and our loved ones to get fully vaccinated. We're in the holiday season. Families and friends will gather to celebrate, and the vaccine will help us to stay safe. And you know you're going together. You know you're going to be inside as well as outside. You know you're going to be having conversation, and we need to do everything to keep you and everyone else safe. It is the best tool we have to remain healthy and prevent it from spreading to our loved ones. It is this vaccine. It's the best gift that you can give this season to others as well as yourself. And what we want to do is just make it available to you. So it's the best gift you can give. But if you come on Friday, December the 17th, from 12 to 8 p.m., not only do you get the gift of the vaccine, but for your kids, they can walk away with a coloring book and the toys as well. I mean, what a good deal. And lastly, what I will say as I close, I recall reading about the First Lady visiting with kids who were getting vaccinated. As Dr. Biden said, I can't promise you that the dangers of the world will become any less frightening, but with this vaccine, we can take away at least one of those big worries. So let's do our part to erase fear, eradicate virus, vaccinate our children, and save lives. And we have done well in this city, but we also need to bear in mind that it's not over. until every single person is vaccinated or gotten their booster. And I really want to encourage people to get their booster if they've been vaccinated in the last 6 months or 2 months after J&J. Get the booster. Let's do the right thing. And then we can celebrate these holidays together, knowing that we have at least done our part to keep others and keep ourselves safe. Now, let me yield for a moment. And Dr. Purse, what you want to add, and then Michael Heckman, and then Abby Kamen.
Thank you, Mayor. And first, I'd like to thank Texas Children's Hospital for once again stepping up and being a leader in our community, not only looking out for children, but also looking out for families. And I think that you can see from the effort that they put forward together, they've corralled members from across the community, including the city of Houston and others, to make this effort. So on Friday from noon till 8, we can vaccinate families. And again, I want to remember it's families. And you know, as we enter the holiday season, this is a family time, and there's nothing more precious to any of us than our children and our families. And so as the mayor says, you know, this is the best gift that anyone could give. And again, I just want to reinforce the earlier message. The vaccines are safe, effective, and available. And during the holidays, we hear people talking, and we've already heard some of the pundits talking about how, well, you know, with the holiday season, people gathering, well, if everybody's vaccinated, it's not going to be an issue. And so for those folks who are due for their booster, get it now. For those folks who haven't been vaccinated, and I'm really talking to the adults, right, go ahead. And let's get started on that. And for, you know, the parents, let's go ahead, get your kids vaccinated. That's what makes us safe. And it's not just about me, it's about all of us. And so, again, thank you to Texas Children's for being leaders yet again in looking out for the whole community, not just kids. Thank you.
Michael.
Dr. Purse, thank you. Thank you for your work over this long period of time that we've been dealing with COVID. Mayor, thank you for your leadership. Everyone here at Texas Children's. Every time I come out here to the Texas Medical Center, I'm constantly impressed with how we have the biggest and, in my view, the best medical center in the world with world-leading institutions, in particular Texas Children's. I was able to see a little bit about the process, highly coordinated process of how families are brought in here and the work that has been done to make them comfortable for the vaccines to be administered, and I'm so impressed with that. You know, as you look at the work that we do at Houston First for promoting Houston around the world, operating our convention and theater facilities, we have been able to largely be able to activate those again because of the vaccines. Where we were 1 year ago is a much different place. So we join all the voices that say, please, for your families, get vaccinated. We're so proud at Houston First. We do a lot for this community, but maybe there's nothing that will be more important than this community-related partnership that we'll be able to do to be able to host these at the George R. Brown Convention Center. Our staff will be accommodating, excited to be able to do this. I think everyone knows where the GRB is, so it's an easy place to get to. Free parking, I think, as was mentioned earlier. Shuttles. Metro has the ability to get everyone down there in a safe and easy way. We're just proud to be able to play one small part in this. You know, the medical professionals and the leadership from around this community making this happen. And for our team at Houston First, we're proud to be able to do this. So we hope to be able to see thousands and thousands of families down at the George R. Brown and be able to fill it up. And with that, we look forward to a very exciting day. Thank you all.
Thank you. When I heard about this incredible effort and joint partnership to get more vaccines out into the community, I had to come down here and personally thank Texas Children's for all that they do. From our chiefs to our nurses, our doctors, all the way to our janitorial staff. Thank you for everything that you have done to save lives. I'm humbled to be here because of who you are for Houston. You are truly our heroes. And today is actually the 9-month birthday of my son, who I actually delivered right here at Texas Children's. And because of the work that they are doing, they have made the vaccines accessible to pregnant women. So I'll start by saying, please, if you are pregnant, talk with your healthcare provider about getting the shot and taking advantage of this opportunity, because as we're seeing here, even at Texas Children's, pregnant women are more likely to end up in ICU. They are more likely to go into preterm labor, among other complications. So please protect yourself and your future child. And I also wanted to speak to the fact that there are many families in our Houston area that still cannot get their children vaccinated. And to give them the gift of protection, we all need to be protecting ourselves, our families, and children that can get the vaccine. So again, I want to thank everyone at Texas Children's. Mayor, you for your leadership, and Dr. Peirce, you have been there since day one. Houston First, thank you. But really, thanks to the community, and I implore everyone to consider taking advantage of this opportunity. I also wanted to spotlight that even after the vaccines, the work is going to continue, and it must. The trials that Texas Children's is doing right now, but also the work through the Mayor, your Women's Commission. We actually have Dr. Cody Weiner and others from Texas Children's who are doing that work to address the pandemic and the disparities for families right now. So again, please take advantage of this opportunity, and my heartfelt gratitude to everyone at Texas Children's and our entire medical community here in Houston.
Jermaine, and I'll turn it back to you. But let me just say, we're planning for 5,000 on this coming Friday at the George R. Brown. Free parking, Metro. Please come. This is one of the best partnerships between Texas Children's Hospital and the city itself. And we want you to come, and it's a family affair, okay? It's a family affair. And the best thing would be for parents to come, bring their children, and the family as a whole get the vaccines. And so we look forward to seeing you there. We'll also prepare to have somebody play Santa Claus. You know, I may have to buy me a beard and put it on, but come and keep yourself safe. Jermaine.
Thank you, Mayor. We'll bring a suit for you. You can play Santa. We appreciate that. We appreciate that offer. So I want to bring up a very important person that's been critical to this effort. Our co-chair of our vaccine task force, Dr. Julie Boom. She's also our director of immunization project and has worked tirelessly in her career around immunizations, and I'm proud to be her colleague and partner in this effort. Dr. Julie Boom.
Thank you, Jermaine, and thank you, Mayor Turner, so much for your support for this event. It means so much to Texas Children's, and it really means so much to the families of the greater Houston area. So we really appreciate that. So as director of the immunization project at Texas Children's, I want to tell you what some of my firsthand experiences have been with COVID in children. So if you're a parent or a grandparent or you're close in the life of a child, please do not minimize the impact of COVID in children. Most people don't even realize how many children have been sick with COVID. In the United States, we've had over 6 million children that have come down with COVID, and almost 1,000 children have died. Almost 1,000 children have died. And so this has really been a tragedy. And I think in any other time, having 1,000 children died would have been all over the news every day. So it's really a myth that it doesn't affect children. It's important to realize this. If your child gets hospitalized, 1/3 of those children end up in the ICU. And that's what our experience has been at Texas Children's. And we do not want that to happen to your child. In addition, children are getting long COVID. And just like adults, they can get the brain fog, the fatigue, the chest pain that really lasts for weeks or months. Children can also get something called MIS-C, or multisystem inflammatory syndrome in children. And MIS-C has affected over 5,000 children in the United States, and 52 children have died of MIS-C. And what happens is several weeks after their COVID illness, they come down with fever or abdominal symptoms, and this truly can be life-threatening. So we are so happy that for the past 6 weeks, we have had a safe and effective vaccine for all persons 5 years and up. And the COVID vaccine for the 5 to 11-year-olds is 1/3 of the adult dose, 1/3. And we've found that it's very well tolerated. It really prevents COVID very well. 9 out of 10 children after getting vaccinated will not get COVID, so this is amazing. And compared to young adults, they are even having fewer side effects from the vaccine. So while children may get some soreness or redness, they get fever even less commonly than our young adults do. So even though there's been a rare effect of myocarditis in young men, we are not seeing this in children so far. So that's really exciting news. Some parents have been afraid to give their child an mRNA vaccine. And I want you to know that these vaccines are very safe. We've had over 240 million doses being given. It's been widely the most safe, the most widely studied vaccine from a safety standpoint, and it is very safe and effective. So I don't want you to be concerned about giving your child an mRNA vaccine. So if you've been sitting on the sidelines till now, which I know many parents have, it's really time to get off the sidelines and come into the field and vaccinate your child. We want your child to be protected against COVID. As we move into the holidays, as we've all mentioned, it's the most important gift that you can give, and we want your family to be protected. We don't want a child who's been around other children to bring that home to your family. So really the only way to make sure your family is safe is to vaccinate your children. So please come out, join us at the George R. Brown. We will be excited to see you there, and we will make it as happy an experience as we can. So I'd like to invite Dr. Flor Munoz, who's been doing some of the vaccine trials at Texas Children, to join us and answer some questions.
Thank you so much, Julie, and thank you for this opportunity. It's an honor to be here with you this morning. And I've been asked to see if, before we do questions and answers, if I could say in Spanish a little bit about what you've been discussing.
I intended to do that, but you go ahead.
I will be brief. I'm sorry. Voy a hablar en español para nada más comentarles lo que se ha desarrollado esta mañana acá. Yo soy la doctora Muñoz, yo soy investigadora y también médico clínico aquí en el Texas Children's y tengo el honor de representar a nuestro equipo. En Texas Children's estamos con la promesa de estudiar las vacunas y de administrar las vacunas en la población. Y estamos acá en colaboración con la ciudad de Houston, con el alcalde de la ciudad, el alcalde Turner, y su equipo y el equipo de Texas Children's Hospital para informarles acerca de un evento que se llevará a cabo este día viernes, el día 17 de diciembre, desde el mediodía hasta las 8 de la noche, en el cual se estarán dando vacunas para los niños, para los padres, para las familias enteras de COVID-19. Es un evento en el cual se está colaborando para que haya oportunidad de que las personas que aún no se han vacunado se vacunen, aquellas que necesitan refuerzos se vacunen también y que sea un evento familiar, alegre, en donde vamos a estar aquí representando a todo este grupo que nos interesa la salud de la población de la ciudad de Houston. Entonces es nada más para invitarles a que vengan. Es en el George R. Brown Convention Center, en el centro de convenciones en el centro, el día viernes 17 de diciembre, de 12 de la mediodía hasta las 8 de la noche. Los esperamos, por favor, vengan con su familia, que tenemos vacuna, que es segura, eficaz y que está disponible para ustedes. Gracias. Is that good? Okay. Should I stay here? Perdón, me dice que también que para que sepan de que para el evento del día viernes en George R. Brown está también una colaboración con Metro y Metro estará dando pasaje gratis. Pueden ustedes nada más decir que van al centro de convenciones a su vacuna y pueden recibir el transporte gratis ese día. Yes, también van a ver algunas otras cosas para los niños. Se les estarán entregando regalitos, juguetes, libros para colorear. Es un evento familiar en donde definitivamente la vamos a pasar bien y además nos vamos a proteger en contra del COVID-19.
Y el estacionamiento también.
El estacionamiento es gratis. Dice que también, aparte de que Metro les proporciona el pasaje gratis, el estacionamiento en el centro de convenciones es gratis para los que vengan a vacunarse. Anything else?
No.
Okay. So sorry.
Gracias.
De nada.
Questions that we can answer or address?
Questions. One, the TMC numbers this morning, could you guys comment on those? It looks like in the past week they've started to tick up. Not a huge amount, but I'm wondering if that's a sign of cases that may have come because of Thanksgiving gatherings.
Dr. Pasalvic, do you want to address that?
The numbers are trending upward. There's no question about that. Here in the Texas Medical Center, Texas Children's included. We know Omicron is in the city. The new variant is here. We know that Delta is still dominant, so we want to stress that. And yes, some of that may be due to holiday gatherings over the Thanksgiving period. Obviously, we continue to have people gathering. We want to remind everyone to, again, get vaccinated, get boosted, wear a mask. And this event is timely due to what we are seeing now in the trends here, locally and nationally. And as we look at the variants that are, the new variant that has arrived to the greater Houston area.
What can Texas Children's tell me about the next age group that's going to be vaccinated? Any prediction on when a vaccine will be available to those under 5?
So yes, thank you for that question. I mean, clearly we want to have all children vaccinated. The clinical trials that we are conducting at Texas Children's start with age 6 months to 11-year-olds. And by the way, those children 5 to 11 who are participants of the study continue to be in the study as we have approval, yet the vaccine is under emergency use authorization. So we continue the clinical trials. And the goal is to also complete the information that is required for application to the FDA for children under 5, so 6 months to 4-year-olds, sometime early in 2022. So it is anticipated that as the study is progressing very well, this is a national and global study actually, that there will be enough data that will be prepared similar to the 5 to 11-year-olds in a packet that will be submitted to the FDA early 2022, expecting approval also by the CDC, and then emergency use authorization for children under 5, hopefully in the first quarter of 2022.
Are you able to tell me in your research, are you seeing that that young age group is tolerating it as well as the 5 to 11-year-olds do?
They are tolerating it better, actually, you know.
My son is in it.
So actually, you know how we talked about the dose? Dr. Boone mentioned, you know, children 5 to 11 receive 1/3 of the dose of the adult vaccine. For children under 5, we have determined through the clinical trials that 1/10 of the dose is sufficient. So 3 micrograms, not 10, not 30, is sufficient for them to have a excellent immune response. They make the same amount of antibodies, so protection that adults get with that very tiny dose. And that means that they have almost no reactions. They tolerate it so well that sometimes, you know, the parents try to guess whether they had vaccine or placebo in the trial, and it's impossible. I can tell you that because they do very well. And that is on purpose. It's by design that we want a vaccine, again, that is safe and effective for children of all ages.
Doctor Muñoz, Carlos de Paya de Cadena Telemundo, ¿cómo está?
Muy
¿Nos
bien.
puede decir para los padres que están reacios a vacunar a sus hijos menores que empiezan de 5 años en adelante? Dicen, los niños no se contagiaban al principio de COVID. El COVID es una farsa. ¿Qué les diría a ustedes ahora que va a haber esta oportunidad de que se vacunen?
Con mucho gusto. Hablábamos hace un momento con los datos que mencionaba la doctora Boom. En nuestro hospital de niños hemos visto muchos niños que han tenido infección por COVID-19 y 1 de cada 3 niños que están hospitalizados requieren atención en el intensivo y algunos de estos niños han tenido complicaciones graves. Los niños también sufren de efectos muy graves de esta enfermedad, pueden tener neumonía, pueden tener unas complicaciones muy específicas en pediatría, como el síndrome sistémico inflamatorio, y también tienen síntomas de COVID largo, COVID prolongado, igual que los adultos. Entonces, hemos aprendido conforme ha cambiado la pandemia y el tipo de variantes que están circulando, que definitivamente los niños están afectados directamente en su salud y también indirectamente porque estamos viendo el efecto que tiene COVID en sus familias, en la escuela, en su salud emocional y psicológica, ¿no? Entonces necesitamos tener vacuna para los niños. Hemos visto que estas variantes nuevas, específicamente Omicron, que está empezando a surgir, también afecta a los niños y a las poblaciones no vacunadas. Y mientras no tengamos a todos vacunados, puede haber un resurgimiento de estas nuevas variantes y poner a riesgo a los niños y a sus familias.
Doctora Muñoz, justamente, ¿cuáles han sido los efectos que han visto de la variante Omicron en los niños hasta el momento? Sabemos que todavía es temprano, pero ¿cuáles han sido algunos de ellos?
Es temprano, pero según los datos de África del Sur, ellos han demostrado que sí hay una tendencia a que la gente joven, incluyendo niños, esté afectada más por esta variante. De nuevo, puede ser un factor de la falta de vacunación o también factor de que es más contagiosa esta variante y nos afecta más a todas las edades.
Going back to the event on Friday, I know you're wanting the people who are on the sidelines to get off the sidelines and show up. What about the people who have had previous infections and are saying that they don't need a vaccine because they feel that they have natural antibodies? Any encouragement for those people?
So we know that those individuals who've had COVID before are not fully protected and are much more likely to get COVID again. Whereas if you vaccinate yourself, you really can help prevent future COVID infections. And I want to say a quick thing about boosters. Boosters are really important as we're looking at immunity over time. It seems that if it's been 6 months, we need to boost your level up again. So please take a moment. Join us at the George R. Brown, or go to your local store. They're at every corner drugstore and supermarket now. So please take that moment, go get a booster dose. They're approved for all persons 16 years and up. Whether you've had COVID, you haven't had COVID, you need to get vaccinated and boosted.
If Friday's successful, do you have plans on doing this again?
I'm going to turn that to Jermaine.
So we've actually been in the community since the beginning of May, starting with 12 to 15-year-olds, and we'll be back at George R. Brown January 7th as well. I think the key thing is we'd love for 5,000 plus to show up on Friday, but the time is now. If you're watching this now, we are available to provide vaccines to you today. We'd love to have 5,000 plus, but don't wait. We have opportunities, and not just here at Texas Children's, but anywhere in the community to get vaccinated. It's going to be a great event at George R. Brown, but anytime before or after, please join us at Texas Children's.
And if I can join, look, these gatherings are not stopping. If you're traveling anywhere around this city, whether you're going to restaurants, when you're going to a concert or something like that, people are gathering. So with that being said, it is very important for people to get the vaccine. Okay. What we do know is that the city is not shutting down and people are not staying home. People are going to work every day. They're socializing every day. They're with family members every day. And when you know that the vaccines work, why not get vaccinated? So we'll continue to do it as long as this COVID is around. These efforts will continue. But Friday is special because it's just before people gather for Christmas, and may not be fully vaccinated, but you'll get some protection from it. So this Friday from 12 to 8 p.m., we tried to make it such that even if you're working up at 5 or 6 o'clock, you can still come down. So come and, get the vaccine and get the toys that will be provided. And then check out downtown on the east and west side. The lights are out there. So you can go from the east side to the west side and just make it a total family event on Friday. The weather will be good. Won't be nearly cold as the weekend. So please come and enjoy. Did I get it? I think we're good.
Thank you.
Thank you.